Ambien may make users feel sleepy during the day. Talk to your doctor if this occurs, and the dosage may need to be adjusted. Dizziness may occur. If dizziness persists or worsens, tell your doctor immediately. Side effects that patients may experience while taking this medication include stomach pain, headache, muscle pain, stuffy nose, dry mouth. Ambien drug and how to use it with the highest efficiency. Ambien is indicated for the short-term treatment of insomnia characterized by difficulty initiating sleep. 1.Therapeutic Ambien. Ambien is a brand-name drug containing the active ingredient Zolpidem, which belongs to the group of insomnia drugs, indicated for sleep disorders in adults. In patients with difficulty falling asleep, Ambien helps patients fall asleep faster and maintain deeper sleep. The mechanism of action of the drug is to cause a calming effect on the patient's brain. Ambien is only used for a short time, at most 1 to 2 weeks. 2. Instructions for use of the drug Ambien. Read the medication guide carefully before you start using a medicine containing the active ingredient Zolpidem. Ambien is taken by mouth, should be taken on an empty stomach as directed by your doctor, usually 1 time per night. The active ingredient Zolpidem is fast-acting, so patients should take it just before going to bed. Do not take Ambien with food or use it after a meal because food will make the drug ineffective. Use Ambien, Zolpidem tartrate, when you are sure you have enough time to sleep continuously for at least 7 to 8 hours. If the drinker is forced to wake up earlier than expected, he may become absent-minded and have difficulty doing things that require alertness, such as driving or operating machinery. Ambien dosage is calculated based on gender, age, medical condition, other medications being taken, and response to previous treatment. Do not increase your dose, take it more than once a day, or take it longer than prescribed. The dose of Zolpidem should not exceed 10 mg per day. Women are often prescribed a lower dose of Ambien than men because of the slower time it takes to remove the drug from the body. In the elderly, the dose of Zolpidem needs to be used lower than in the young to reduce side effects. If Ambien is abruptly stopped, the patient may develop signs of withdrawal syndrome, such as nausea, vomiting, flushing, stomach cramps, anxiety, and tremors. To prevent this, your doctor may reduce your dose of the medication slowly. Although Ambien works for many people to cure insomnia, it is sometimes addictive for others. The risk of addiction increases if the user has a stimulant use disorder, such as abusing or addicted to drugs or alcohol. Therefore, it is necessary to use the drug exactly as prescribed to reduce the risk of addiction. When using Ambien for a long time, the sleeping effect of the drug may decrease or disappear, so you should talk to your doctor if the drug is no longer effective. If the patient's sleep disturbance persists after 7 to 10 days of taking the drug or worsens, the treating physician should be reported immediately. Patients may have difficulty sleeping the first few nights after stopping the medication. 3. Side effects of the drug Ambien insomnia. Ambien may make users feel sleepy during the day. Talk to your doctor if this occurs, and the dosage may need to be adjusted. Dizziness may occur. If dizziness persists or worsens, tell your doctor immediately. Side effects that patients may experience while taking this medication include stomach pain, headache, muscle pain, stuffy nose, dry mouth, irritation of the nose and throat, nausea, daytime drowsiness, dizzy, not feeling well, feeling drunk or lightheaded, tired, constipation, diarrhea. Patients should stop using Ambien and call their doctor at once if you have the following symptoms: emotion, illusion, memory problems, change in temperament, chest tightness, fast or irregular heartbeat, difficulty breathing or swallowing, thinking about suicide or hurting yourself. The above are not all possible side effects when taking Zolpidem. If you have other effects, contact your doctor or pharmacist. 4. Precautions for side effects. The effects of the insomnia medication Zolpidem can last until the next day when you wake up. Therefore, do not use this medicine when you cannot get a full 7 to 8 hours of sleep each night, or when you are taking other medicines that cause drowsiness or increase your sensitivity to the active ingredient Zolpidem. Some patients may experience dizziness or blurred vision, double vision. Alcohol or marijuana makes dizziness worse. Therefore, patients should not drive for at least 8 hours after taking the medication or do any work requiring alertness until you can safely do so. Before taking Ambien, the treating doctor needs to know the patient's history of allergy to Zolpidem or any other allergic conditions. Elderly people are more likely to have unwanted effects when using Ambien, especially dizziness, confusion, unsteadiness and excessive drowsiness. These side effects may increase the risk of falls in the elderly. Before starting use, the patient needs to inform the doctor about the previous medical history, especially kidney disease, liver disease, mental illness, such as depression, appearance of suicidal thoughts, personal or family history of substance use, such as drug or alcohol abuse or addiction, personal or family history of sleepwalking, respiratory conditions, such as obstructive pulmonary disease, chronic obstructive pulmonary disease, sleep apnea, myasthenia gravis. Children are more sensitive to the side effects of this insomnia medication, especially dizziness and hallucinations. Immediately contact medical facilities when you notice any abnormal signs in your child. Talk to your doctor about pumping and expressing breast milk for 23 hours after taking Ambien to reduce the risk of unwanted effects. Pregnant women should only use this medicine if it is absolutely necessary. Babies born to mothers who used Ambien during the 3rd trimester of pregnancy may experience unusual sleepiness, difficulty breathing, or signs of withdrawal. Small amounts of Zolpidem pass into breast milk and may cause undesirable effects on a nursing infant, such as unusual sleepiness, trouble breathing, or unusual weakness. 5. Interaction with drugs for insomnia treatment. Ambien. One product that may interact with Ambien is sodium oxybate. A number of other drugs affect the elimination of Zolpidem from the body and the action of this medication for insomnia. These drugs include azole antifungals, such as ketoconazole, rifampin. Check the ingredients in some of the medications the patient is taking, such as anti-allergy or cough-cold medicines, as preparations may cause drowsiness. Consult your pharmacist about using the medicines safely. Drug interactions can affect effects and increase the risk of unwanted effects. Therefore, to reduce drug interactions, tell your doctor about all the medications you are taking before taking Zolpidem. Absolutely do not arbitrarily use, stop or change the dose of any medicine, including Ambien, without the guidance of the doctor. Advanced age affects a patient's sleep habits naturally, and sleep can be disrupted several times during the night. Talk to your doctor about ways to improve sleep quality without medication, such as limiting caffeine and alcohol at bedtime, avoiding excessive daytime sleep, and developing a bedtime routine on time every night. The risk of serious side effects, such as slow, shallow breathing, drowsiness, dizziness, is increased if Ambien is taken with other medicines that also cause drowsiness or breathing disturbances. Be sure to tell your doctor about certain products you are taking, such as opioid pain relievers or cough suppressants, such as codeine, hydrocodone, alcohol, marijuana, sedatives or anxiety relievers, such as alprazolam, lorazepam, zopiclone. Muscle relaxants, such as carisoprodol, cyclobenzaprine, antihistamines, such as cetirizine, diphenhydramine. 6. Can Ambien drugs interact with? To avoid drug interactions, it's best to write down a list of all the medications you're taking, including prescription, over-the-counter, herbal, and dietary supplements, and show them to your doctor or pharmacist. To ensure safety when taking medicine, do not arbitrarily take the drug, stop or change the dose of the drug without the permission of your doctor. Ambien may change how other medicines you are taking work or increase the effects of side effects. Drugs that may interact with Ambien include rifampin, sertraline, imipramine, chlorpromazine, itraconazole. 7. Who affects the drug Ambien? Your medical condition may affect the use of this medicine. You need to tell your doctor if you have any health problems, especially those who, lung disease, infarction, history of depression, mental illness or suicidal thoughts, history of drug or alcohol addiction, kidney disease, liver failure. 8. Are there any precautions in the process of using Ambien? Patients should avoid taking Ambien while traveling, such as sleeping on an airplane. Because you can be awakened before the effects of the drug wear off, this will lead to a higher risk of memory problems, forgetfulness, if you do not get enough sleep 7 to 8 hours after taking Ambien. You may still feel drowsy the morning after taking Ambien and your reaction may be impaired. Therefore, avoid driving or dangerous activities such as operating machinery, because when driving, the influence of Ambien drug may not be completely gone. You should therefore wait until you are fully awake before driving, operating machinery, operating an aircraft, or doing anything that requires you to be alert. Do not take this medicine if you have been drinking alcohol during the day or right before bedtime. Any drug, whether used to treat disease or support health, has its own principles of use. If you do not understand the basic principles when using drugs, patients may misuse them and bring harm to them. Unwanted effects. Please consult your doctor before using medicine. Please click subscribe and press the notification bell to support me. Thank you.